Hello everyone. We are here at this conference to educate medical professionals about the condition Situs Inversus. I'm Madison Winsand and I'm here today with my colleagues Maya Anderson and Brittany Winnicky. The definition of this condition is a condition in which the arrangement of the internal organs is a mirror image of normal anatomy. This condition can be isolated or part of another syndrome. Its cause is genetically complex. It seems to run in families, but different genes cause the condition in different people, which is called genetic heterogeneity. Mirror image twins is another potential cause, when one twin has a typical anatomy and one has situs inversus. This happens when the fertilized embryo splits later than usual during pregnancy. Here's the anatomy. On the left you can see a typical anatomy, and on the right is the situs inversus anatomy. As you can see, the image on the right is a mirror image of the anatomy on the left. In terms of diagnostic techniques, this condition is typically first recognized via imaging, such as ultrasonography and radiography, typically when looking for an unrelated diagnosis. For a definitive diagnosis, a CT scan is used due to its better anatomical detail than the previous imaging techniques. An MRI can be used for difficult cases, including cardiac anomalies. There are some other important differential diagnoses to make to ensure there aren't any other reasons to explain why an organ might appear to be in the wrong location on an image. Asplenia and polysplenia, when there is no spleen or multiple spleens, or congenital coronary abnormalities, when vessels are located in the wrong location, typically the coronary artery, and sinusitis, which can cause the sinus to show up dense, mistakable for a bone on an image. As you can see in this heart image, the heart is more to the right side of the thoracic cavity, when it's typically more toward the left. The left lung is smaller and has 2 lobes instead of 3, but in this case the smaller 2-lobed lung is on the right side as well, which is why the heart can be on that side without any malfunction.
In most cases of situs inversus, there is no treatment necessary and the patient can live a normal, happy life. Surgery is not usually recommended to position organs in their normal anatomical positions unless the organ is causing a health problem. Moving the organs would cause more harm than good in most cases. Although there is not necessarily any treatment needed, diagnosis is essential to the health of a person with situs inversus. The knowledge that a patient has situs inversus allows practitioners and other healthcare individuals to properly diagnose and treat other conditions. The orientation of the organs is essential to making the correct diagnosis. There could be serious health implications if situs inversus diagnosis is unknown and a patient is misdiagnosed, such as in the case of appendicitis. Thus, it is helpful for those with the condition to wear an identification bracelet to notify medics in cases where the person cannot speak to alert the medics of their condition. Cases of situs inversus that may need treatment are those that have associated health implications. In regards to lungs, those with situs inversus are more likely than the general population to have a condition called primary ciliary dyskinesia. This condition is specifically referred to as Cartaginer syndrome in those with situs inversus. Primary ciliary dyskinesia affects the cilia in different areas of the body, such as in the respiratory tract, in sperm cells, and in the movement of eggs in fallopian tubes. In turn, these areas containing cilia are affected, causing chronic respiratory tract infection and infertility. 50% of people with primary ciliary dyskinesia also have situs inversus. There are also implications that may arise with the heart, largely depending on what heart orientation the condition causes. There are 2 main classifications, dextrocardia and levocardia. Dextrocardia is present when the point of the heart points to the right side. This orientation usually has a small percentage with congenital heart defects, which is usually a result of transposition of the great vessels of the heart. Levocardia occurs when the heart is in its normal position, but all other organs are flipped. This condition is more dangerous and has more health risks because it does not align well with the other organs and usually has more cardiac abnormalities. However, levocardia is more rare than dextrocardia.
Situs inversus has many health implications, and its effect on the brain is one of them. In order to see if situs inversus affects the brain, an MRI of brain asymmetry must be performed. The brain MRI specifically looks at the 2 major asymmetries, these being the frontal and occipital patellae. The MRI concludes deviations from the expected brain pattern. It also shows different language dominance patterns. These patterns suggest that the developmental mechanisms underlying visceral organ asymmetries are related to those underlying functional brain asymmetry. This image shows the difference between a normal brain and a situs inversus brain. The top images compare the brain's occipital patellae, and the bottom images compare the brain's frontal patellae. One of the main diagnostic challenges is referred pain. An example of this is appendicitis. This condition causes pain in the right lower abdomen. An individual with situs inversus would have pain in their left lower abdomen. This would make it difficult to diagnose the issue as well as performing surgery if needed. These diagnostic challenges lead to surgical challenges. Situs inversus is a significant condition to providers. Doctors come across a case like this once in their lifetime. They make it a point to perform as much research as possible to further help diagnostic challenges for the future. This helps prevent misdiagnosis and procedural mistakes. Here are our references, and this is how each of the members contributed to the project.